I'm going to just share one thing here on screen just so everyone can see. So you can see the female anatomy right here is the urethra. Here's the bladder. So you can see very short distance from the urethra to the bladder. You can see here in the male anatomy, right, much longer distance to get up here. Obviously, in the urinary tract, you're just typically with the UTI, it's the bacteria that's making its way up here, okay, into the urinary tract that's causing the infection. Like Evan already mentioned, that's mostly going to be bacteria, right? Usually on the UTI side, it's going to be E. coli. There can be some Pseudomonas. That's mostly E. coli. And so it's really easy for women to get a bladder infection because you can see it goes up faster. Again, things like birth control pills we'll talk about and antibiotics really shift the urinary pH and the intestinal pH, which has a major effect on the bladder and the urinary tract, and it makes it easier for bacteria to grow. So that tends to be why women are a little bit more susceptible in that. Definitely for bladder infections, obviously, but in general, you're going to see that with birth control pills because of how estrogen affects the pH. And then also women, when they menstruate, right, just that whole vaginal area, right, they're sloughing off that endometrial lining. All that blood flow does shift that whole entire area to be way more alkaline because blood's around 7.3 pH. So it does shift that whole vaginal tract to be more pH, higher on the pH side, which can increase other bacterial infections more on the vaginal side. But hopefully that helps. Any comments on that, Evan?
Yeah, it's totally interesting, and this is stuff that maybe you didn't pay attention to in school and biology class, but now in adulthood, it's a lot more important. And I think people just don't even understand the anatomy of it. And this is something that, according to the research here, 25% of people treated for UTI, they will experience a recurrence 6 to 12 months later. So, I mean, that's a quarter of these people that now have another UTI and they just go on this merry-go-round. And of course, every time you go on these antibiotics, you're damaging the mitochondria, you're damaging your gut microbiome in total. So this, uh, it's not just this one thing that you're doing, it's the sum to your system. And it can really add up.
Yeah, when we deal with urinary tract issues, I kind of look at, okay, you have yeast issues over here. They intermingle, right? And how the different things happen. You have bacterial issues over here, right? So your UTI issues are primarily bacterial, right? Affecting the urinary tract. You can have BV, bacterial vaginosis. That's another bacterial issue, usually Gardnerella bacteria in that one. That's affecting the vaginal canal. So a little bit different, right? Different, same general area, different anatomy per se. You're going to have a similar sequelae of issues affecting it, right? The big difference with the BV issue is you're going to get the potassium hydroxide odor, that's kind of the fish smell. That's what the bacteria in the vaginal canal does. It creates that potassium hydroxide. That's the fish odor. You're not going to quite get the odor with a UTI, but you will have the burning during peeing. So that's going to be the big differentiating factor. Sometimes more odor on the BV, but sometimes you can have none. And then, of course, more pain during urination on the urinary tract issue. And then if that's continuing to be left up, that bacteria will eventually continue to go north and eventually hit the bladder. As you can see, that anatomy is pretty short on video here. But one of the big common issues is, I would say, like the big three, anytime I look at these problems, they tend to be the same. It's going to be a combination of antibiotic use. So we're wiping out a lot of the good flora in our intestinal tract, which also affects the vaginal or urinary microbiome. And then that affects the beneficial probiotics that actually make hydrogen peroxide. Like probiotics actually make hydrogen peroxide, which is antibacterial. They'll make different acids, glucuronic acid. They'll make acetic acid, different acids that actually help keep the microbes in check. They make hydrogen peroxide, H2O2, and it keeps a lot of the bad bugs down. So the first thing is we have a wiping out of the beneficial flora. That also can drive yeast overgrowth too. So the same thing where it wipes out the good stuff, the beneficial probioflora, the probiotics, the bifidobacter, the lactobacillus, the different species within the bifidobacter and lactobacillus, right? There's reuteri, there's casei, plantarum, lactis. These are all beneficial species, okay? That keeps the bacteria in check, but also when you knock down a lot of the good stuff, that can also cause this rebound overgrowth in yeast. And that's why a lot of doctors today, even on the conventional side, tend to give an antifungal after an antibiotic in a lot of their female patients because they see a lot of these symptoms happen frequently.